Being an oncology nurse is truly an honor for me. We help patients from the time of diagnosis. We help them understand what their plan of care is. We do a lot of education and getting patients through the journey of cancer and cancer treatment.
Cancer is devastating to patients. It disrupts everything in their lives. I can't really relate to a cancer patient in the way that I've never been a cancer patient before, but I can certainly relate to the family members and having lost a loved one to cancer.
I think that we're very fortunate to have access to an amazing network of providers. You don't have to go out of town, you don't have to go to LA to get this kind of amazing, cutting-edge, evidence-based care.
We educate every patient on the side effects of radiation prior to their first treatment. We show them a little video and then we talk to them about their course of treatment so they know what to expect during radiation.
People are facing a terminal illness and it can be demanding emotionally for us.
The most difficult time for me is when we get young patients in, that have young kids.
Caring for patients at the end of life is a gift, and I actually enjoy that time. But I had to care for a patient that I had known for a long time who was young and had a young child who was 2, and I cared for her when she passed away. Just seeing a child, see their parent pass away was, I think, probably one of the hardest things I've had to be a part of.
And this patient came in and he was a college student and I knew he wasn't going to make it. Every time I saw him, I saw all my kids' friends. I remember going into a room and I took a pillow and I just put the pillow to my face and I just cried. And I learned so much from them because they're just such an inspiration and I get such a perspective on life.
We're surrounded by people that are happy to be alive. They don't take life for granted anymore. We get to see blessings every single day in our job, and being that person that gets to help guide them through that is what keeps me going and brings me joy.
I would say the greatest gift that I receive from my patients and from interacting with patients is the gift of being able to truly appreciate kind of the little things in life and the small victories.
Patients say, how can you do this? How can you be an oncology nurse? And I think, how can I not be an oncology nurse? It's a wonderful job, and if we can just lighten the mood a little bit and just make them smile at work, it's what all the nurses I work with do.
Gosh, the greatest gift of being an oncology nurse is the relationships and getting to feel like we make a difference.
I have a lot to offer to my patients. I have learned a lot. I still have a lot to learn. I've been an oncology nurse for 23 years, and I figure I'll be in it for the rest of my life.